Good morning, everyone. Happy Monday. Welcome. Thanks so much for joining us for another episode of House Calls, Real Docs, Real Talk. I am Chelsea Helms, coming to you live from the KNWA News Studio here in Fayetteville, Arkansas. And while I might be in Northwest Arkansas, I am joined by so many awesome people from around the country and even the world. I was just looking through some of our Facebook and LinkedIn comments on the live feed, and I'm seeing so many of you already joining us. So we are so excited to have you here this morning. As you know, House Calls provides an opportunity for us to come together, ask questions of the health experts, and, walk away with some of those answers to those most pressing questions that you guys have. Today, we are going to look into vaping. It is still a big problem, even though our attention has been diverted to the coronavirus pandemic these last few months. If you do have a question you'd like us to address today, or maybe in the future, we encourage you to visit us at heart.org/housecalls and submit your question, or drop it in the comments during the show, either on LinkedIn or Facebook. We're monitoring those. Now, a big part of this show is involvement from you. And so today we have two things we want you to help us with. First and foremost, throughout the show, we're going to break for a few of those questions, and we hope that you're going to respond using our easy text to answer feature. All you have to do is text AHA Live to 22333. You can see it there on your screen. AHA Live to 22333. We're not going to ask you for your name or any information. This is just a really fun and easy way for you to answer. And after you do that, we want you to hit the share button, or maybe start a watch party, whatever's easiest for you, so you can share the stream with your friends and family. I have done the same this morning already, and I'm excited to have some of my friends and family joining us live as well. Like I mentioned, it looks like we already have a great audience joining us. We have Stephanie from Williamsport, Maryland joining us. We have Savio from Uganda. So let's go ahead and get started this morning. With me this morning is Dr. Rosemary Robertson. She is the Deputy Chief Science and Medicine Officer at the American Heart Association. Dr. Robertson, thanks for joining us this morning.
Hi, Chelsea. I'm really delighted to be here.
Well, we are excited to have you. On the topic of vaping, let's go ahead and try our first viewer response question. So everyone, get your cell phones ready. The question is, it's simple. It's, have you experimented with vaping? Yes or no. So once again, texting that AHA Live to 22333 to submit your answer. Dr. Robertson, what are you thinking the majority is going to be here? Personally, I'm going to assume that most people, as long as they're of age, have tried it.
It depends on who the audience is. I think that if our audience is physicians, if many of them are physicians, I bet that not as many will have tried it.
Fair point.
They certainly will have seen patients who have tried it. Look at this. Well, we're seeing some, but
we haven't even seen a yes yet, which to me is surprising. Oh, there we go.
Oh, there we go. So it's going to be it'll be mixed. I think many physicians, of course, the great majority, don't use tobacco products, don't smoke, don't use other tobacco products as well. And so the answer, I know others who do will probably be a fit for them as well. You're absolutely right, though, that, in terms of the public, there are a number of people who do. And of course, of most concern to the American Heart Association has been the huge increase in the number of children who vape. That increased, just within the 2 or 3 years after Juul entered the market with, really quite high nicotine levels and, clever advertising and clever ways to reach teens.
Sure.
We found that, 12th graders, for example, who maybe had used a few vape products, maybe 10-12% of them, suddenly 30% of them had vaped.
Right. Yeah, not surprising when we keep seeing these big market products kind of being pushed into our face. We're going to get to that a little bit later. Let's just really quickly, before we move on, go ahead and look at those results. I think you're right. A lot of people saying, hey, I have not tried it myself, but I know others that do. It's kind of like one of those things where it's all of us know someone who's had cancer. All of us know someone who vapes. So like I said, we're going to talk more about this throughout the show. But first, let's go ahead and get started with our first segment. That is Health in the Headline. Each week, we select one headline that has grabbed our attention and could use some further discussion. This week's headline that comes from WPRI.com, and it reads, "Pandemic and vaping bans has more people smoking traditional cigarettes." Dr. Robertson, why do you think that is?
I think several things came together. Certainly, no question that with the various aspects of just how we live these days to try to mitigate against the pandemic, people are staying at home. Hopefully, they're wearing masks, and I think people became concerned during the period of EVALI, the epidemic that was just before the COVID epidemic, where clearly a serious lung disease was associated with people who vaped. And so there was a real fall off at that time in the use of vaping, and people are addicted to nicotine who vape. Vaping is clearly a way to satisfy that addiction, and so those who hadn't managed to wean themselves off nicotine, hopefully with the help of physicians and other healthcare providers, uh, found that cigarettes were a way to get that nicotine back.
Absolutely. All right, really quickly before we move on, I'd like to give a shout out to some of our viewers. We have Maria, who's watching us from on our Facebook live broadcast. She's coming to us from Chicago, so excited to see her joining us. We also have Peter from New York. He's joining us on our LinkedIn live feed. So thank you both for joining us. So excited to have so many of you here with us this morning. Lots of questions to get to. So with that said, let's move on to You Ask, We Answer. And You Ask, We Answer, we focus on your burning questions. Each week we ask you to submit your questions and we answer them right here live. If you would like to watch some of our past episodes, we encourage you to do so. All you have to do is visit the House Calls website at heart.org/housecalls. There you can find all of our previous shows. Like we've been talking about since the start of this broadcast, this week we are tackling vaping. So Dr. Robertson, our first question comes to us from Sam in Boston. Sam says, "I've heard vaping can be a good way to quit smoking. Is that true?"
Well, there's really not evidence that it's any better than the traditional methods that are approved by the FDA and that can be accessed in most cases for free with your healthcare provider. So there was one single study that suggested that in England, vaping was helpful to people. But in fact, most people who use vaping to quit find that what they do is actually continue to use both products. We call them dual users. We had to have a name for them because so many people who were trying to quit, in fact, continued to use both and really didn't reduce their intake of cigarettes appreciably. Now, some people who have tried other things have found that it helped them. We think that a key thing to do, if that's the case, is to think about the fact that what you'd really like to get rid of is the addiction to nicotine and the fact that you're using products that haven't been proven safe. So if you can set a goal to get off nicotine altogether, that's really the best way to go about it. And if you're not using, multi-episode counseling, the availability of medications, et cetera, and you haven't tried multiple times, we don't think you've exhausted the real benefit that cessation programs can give you.
Well, Doctor, before we move on to our next viewer question, I wanted to ask you, you mentioned those FDA-approved ways of quitting smoking. Can you just briefly tell us what are those? Would it be like nicotine gum? Would it be a patch? What are those types of safe ways to do so?
Sure. There are several things that we think should be really available to everybody through a cessation program. One is counseling. We think it's very important for people to get counseling and not just a one-shot thing. It's good for your doctor or other healthcare provider to tell you to quit, but we really need to have ongoing counseling, multi-episode counseling. Then nicotine replacement, no question, nicotine replacement therapy with patches and gum, things that are FDA approved, and have been tested for safety as well as efficacy. And then, if that's not enough, medications are also quite helpful in terms of reducing the cravings. Nicotine is a highly addictive drug. I've had patients who were addicted, to both nicotine and to heroin say that it was tougher to quit nicotine. So you need help, and medications can help with those cravings. And in many cases, we can be successful. It's important to know that one try that doesn't quite work, that's not a failure. That's the first try. It sometimes takes multiple tries to really make it happen.
What a startling thing to hear, that it's harder to quit smoking than quit using heroin. I mean, I've never heard something like that, but I'm sure you hear things like that all the time as someone in your profession. Let's go ahead and move on to this next question. I know you've kind of already touched on this, but hey, Diane wants to know, is vaping really healthier than smoking? What's the harm if there's no smoke or tar?
Yeah, people think that there's nothing coming at you when you vape. Because there aren't, although there can be big clouds of vape, it depends on the liquids that carry the nicotine and the flavors and such. Um, but but while there's not smoke, there's not combusted material. There is fine particulate material that gets deep into the lungs, and the thing that people really don't realize is that the products that are available on the market have not been approved by the FDA. People think of them as approved, but they are there under a waiver and now are having to come back to the FDA to prove that they are safe. So I think we'll find that a lot of them won't be found to be safe. And we've tested a number of the chemicals that come that you inhale when you vape, and many of them are toxic to cells in the body. If you will, industry gets away with using products that are called, by the FDA, they're called GRAS, generally regarded as safe. But that means they're safe to eat. And that doesn't mean they're safe to inhale. Water is safe to drink, but you don't put it in your lungs.
Oh, that really interesting points there. Thanks for sharing that information with us. This next one, a lot of parents probably have this same question and really the same fear. Carla in Galveston, she says, I think my child is vaping and I'm worried. What should I do?
Yeah, that's boy, Carla. That all parents worry about those things, and we hear from parents and school teachers and school superintendents, uh, and actually from kids who are the friends of people who vape, who are worried about their friends who vape, and they should be worried because nicotine, the main product that people are vaping to get, we know that interferes with brain development. Studies of kids who get nicotine from cigarettes, that there haven't been as many long-term studies in kids with vaping just because it hasn't been around as long. But we find that those kids are less able to develop judgment, critical executive functions of their brain, and they don't realize that brain development is being short-circuited by nicotine. So it's really important, particularly for people who are youth, not adults, under the age of 21. We need to prevent them from having access to vaping, and that means we need policies to do that. But conversations with your kid are really important. And we don't want to make these punitive. We don't want schools to punish kids if they're found vaping. We need to be understanding about this. Kids are under a huge amount of stress right now. They don't even know if they're going to school. That their lives have been turned upside down as everybody else's have, and so we need to be understanding about this. The American Heart Association wants to help with that. And so communicating with parents, going to our website, and working with your child's teachers during the school year, whether they're learning online or learning in school, and consulting with their healthcare provider about the best ways to help them. All those things are really important.
Yeah, hopefully parents heed your warning there and start teaching kids about just maybe not even trying it at a young age or really at all in life. All right, we have a lot more questions that we do have to cover, but let's take a quick break to hear from you again. We want you to grab your phone and get ready to text in your answer to the next question. As a reminder, all you have to do is text AHA Live to 22333. If you've already registered, you're not going to have to do it again. Just get ready. Let's test your vaping knowledge. What is the legal age of purchasing e-cigarettes? We have some people have already answered, and they say 18 years old. 21 is answer A, and then 17, and then none of the above is D. Let's give people a little bit more time to answer before we weigh in, Dr. Robertson. Right. Really quickly, let's say hello to Jonathan, who's watching us on our LinkedIn Live, coming to us from Virginia. So excited to have you. We have Akkad coming to us from Iraq. So that is incredible. Really, that worldwide audience joining us in today, Dr. Robertson. And then we also, on our LinkedIn feed, we have Jerry from Austin, Texas. And then on Facebook, we have Harid from Bangladesh. So thank you to everyone for watching us. We're so excited to have you be a part of this broadcast. And hopefully you got your phones out and you're enjoying entering into these different polls with us. So we can see that a majority of people are going between the 21 and 18 years of age options. So Dr. Robertson, this is something that for a while differed from state to state, but now we have the federal mandate in place, of course. But like I said, some states were kind of deciding 18 was too young. So the legislatures were deciding and lawmakers were deciding to up that age to, the 21. Answer would be 21. Exactly right. So what do you think made the move? What helped influence, I guess I should say, that move from the 18 years of age to 21?
You know, I think a couple of things, helped that happen. One was that we know the science, and we advocated for people under the age of 21 not to be able to purchase e-cigarettes. We know, again, that it interferes with brain development, so we felt very strongly about that. And I believe that in many cases, the science and the push of parents, parents and physicians and other healthcare providers, nurse practitioners, helped educate the public. And I think none of us want things to happen that harm our children. So I think that happened. No question that the epidemic of vaping induced lung injury, EVALI, helped with that. We aren't certain of all the things that can cause EVALI, so that may have not been as logical a reason as just what the science was behind it. But no question that I think it set the stage a little for the idea that we really didn't want kids to vape, and clearly young people were involved in that epidemic. We think that was fortuitous, if you will, to have those come at the same time.
Absolutely. All right. Before we jump back into the questions, I want to take a moment to tell everyone about a really timely initiative available from the American Heart Association, as they are accepting applications right now. It is their Empowered to Serve Business Accelerator. So this accelerator, it's an opportunity to get your community-focused big ideas funded. To date, it has trained 38 social entrepreneurs and provided, get this, $550,000 in grants to top candidates improving health in their neighborhoods. So as we mentioned, the accelerator is accepting applications right now, but the deadline to apply, that is approaching, because guess what? We are already in August, believe it or not, and the deadline is August 31st. So let's watch this short video so you can see a little more about it for yourself. Take a look.
The accelerator has been a great eye-opening experience. It's a chance to step back from yourself, step back from your organization, look at your goals and your missions in a different light, and to reflect on what you're really doing.
I never had a business background. I started a nonprofit because I was passionate about food justice, food insecurity. Honestly, I was frustrated because was trying to find someone or that group of someone's who was responsible for this problem and who should be doing something about it. But then I realized that I'm someone who wasn't doing something about this.
This accelerator has been tremendous for us to come together with multiple entrepreneurs on the same issue, and I no longer feel alone.
The Business Accelerator through the American Heart Association has taught me all the skills necessary to develop a sustainable organization.
Thank you so much, American Heart Association. This opportunity has been wonderful. This money is going to go towards developing the SugarX watch and also developing a solution that better fits the lifestyles of diabetics.
Just an incredible initiative there. So happy to be a part of that. All right, let's go ahead and get back to the topic at hand. You know, it is vaping. We're going to address a few more of your questions now. This one comes to us from Cliff in Kansas City. Dr. Robertson, how is the tobacco industry marketing to kids, and what can I do as a consumer to stop it? A really great question.
That is a great question, Chelsea. I'm just going to take a moment to say that I'm just so inspired whenever I see that video by those spectacular young entrepreneurs who are learning skills that will help them and who are community-based. And boy, that is such an important thing. You know, people in a community know what, you know, could work in their community and, you know, will have the ways to test it. And, you know, you might not think about the Heart Association as being involved in food insecurity. But of course, if people are, you know, aren't able to choose the foods they eat, aren't as able to eat in a healthy way, and they're hungry, so they're going to eat something, you know, there's a place where people in the community can really help. So let's go back to industry and how it marketed to kids. And, you know, you just wouldn't believe the things that that industry would do. And for those of us who've been fighting the tobacco wars, if you will, for many decades, you know, this was no surprise. But industry clearly recognized that social media was the way to you know, approach kids. It was using influencers that kids met on their phone. We invited youth to scientific sessions last year, and it was remarkable when we said, you know, who is it that influences you and your friends to take up something like vaping or, you know, any sort of habit? And many of them, you know, held up their phone and said, my influencers are in here. I haven't met them in person, but they're people that I listen to. And so industry, you know, paid people and hired people to be able to talk to kids and fostered people who maybe even wanted to do it for free, but, you know, made it very easy for kids to get these products, including supporting the development of ways to make it easier to hide a vaping device. So you could be vaping in class. You know, you think about things that people invent, but you know, there are hoodies, for example, and the strings from the hoodie, which you might be fiddling with in class, and you know, kids might chew on the end of a hoodie like they would a pencil or whatever. But those hoodie looking strings are attached to the vaping device inside, and you can be vaping through the string of the hoodie. So, you know, it's unbelievable the things that, you know, that made it easier for kids. They also moved to a new way of providing nicotine. You know, with the outset of Juul, the idea of using nicotine salts, which let you change the pH of the e-liquid and the product so that it wasn't as harsh, so kids weren't as put off by the harshness of smoking cigarettes, which, you know, many kids who started to smoke with cigarettes would find it unpleasant and might not even continue. But they got rid of that. And that also allowed them to provide very high nicotine levels. The e-cigarettes before that weren't able to do that. But these kinds of pods with nicotine salts, and now there are a number of products that use them, provide the same kind of nicotine burst to the brain that an actual combustible cigarette does. So, you know, industry really went after our children. And I think the backlash on that, is perhaps not yet enough, but you can't go after our children.
Well, if you are a parent who is seeing this happening on your, say, your child's social media timeline, is there something you can do?
Yeah, I think there are a number of things that parents and teachers have developed to help you with that. No question that being aware and making it easy for your kid to communicate with you about it is important, and having some control, easier with younger children than with older teens. But again, the American Heart Association's website wants to help you with that. And we ought to put that URL up there perhaps before we go, or we'll make sure that it's attached to this show so that you have ways to do that. We are continuing to work with schools and teachers, understanding that this is a very distracting time with all the other issues, but this is an epidemic too, and this epidemic will harm kids long term.
Definitely. And I wanted to make mention that our amazing team at the American Heart Association, they are keeping up with our conversation on our Facebook Live and our LinkedIn Live. So they are making sure to respond with resources and whatnot. So you should find the link to the website there. All right, Shelley from Tulsa wants to know, besides sharing information with loved ones about the dangers of vaping, what else can I do to protect my kids? I know that we've kind of already went into this, but any just quick remarks on that?
Sure. I do think finding other things for kids to be involved in. One thing that we're doing in schools and with kids directly is to get them involved with other kids who want to have their brains develop properly, and who talk about the subject among themselves. I think kids have to tell us how to reach kids most effectively. It's often the case that grown-ups can't do it that effectively, but there's also the help to be gotten from your child's healthcare provider, and from the school, but also from kid associations and clubs that the AHA will help kids form.
Okay. Our final question today comes to us from Niles in Seattle. Niles wants to know, is there any research that shows vaping is more addictive for kids than adults? An interesting question I hadn't thought about myself.
Yeah, that is an interesting question. I think there are a couple of ways to think about that. One is that the dose of nicotine that can be delivered with the new products is very high. And of course, kids, just because of a smaller body area, are going to get a higher dose than a larger adult would. So less true for older youth, but certainly true for young youth. So the dose is high. The other thing that is an interesting and not fully answered pharmacokinetic question for the basic scientists in the room. These levels rise very high and then drop off very quickly. And we think that one possibility is that you occupy the nicotine receptors and then the level falls off quickly, and whether that is a more powerful stimulus to addiction, is something still being worked on. People couldn't work on it before because this didn't exist. The AHA's investment in science and research on these basic science and clinical science questions about the effects of nicotine are I think that's going to be really critically important. We know some things already. We know that the flavors, for example, one reason we pushed so hard to have flavors taken away was that those flavors can actually be toxic to the cells in the lining of our blood vessels, make them more able to absorb cholesterol and develop heart and vascular disease. And we know that the exception for menthol is a real problem there, because clearly there's been a switch in the naming conventions. People will take things that have menthol, which can be shown to be toxic in some of these settings, and they might take a mint or other kind of flavor and call it menthol, and then be able to sell that. So we're pushing hard to get all the flavors taken out, and we think that's going to be an important move.
You know, I hadn't known that about the cells. So really interesting and a valuable point you make there, Dr. Robertson. I have to say, thank you so much for answering all of these questions very thoughtfully. And I wanted to know how much I appreciate our audience, all of you who are watching us on our live channels right now. We appreciate that. And we appreciate just how much you've been engaging throughout this conversation. When we're talking back and forth, they're also having some really thoughtful conversations on here. I mean, Hannah, she's writing to another person on our Facebook Live about how she used to vape and she quit and how her life is 100% better now. She's tossed all her cigs, she says, and she's never looking back, and offering support to other people who are joining this broadcast. So I have to say, I'm so impressed with the encouragement from everyone. We're now going to move on to our next segment, and that is, what would you say? And what would you say? It's another opportunity for us to hear from you. If you've been watching us throughout the show already, you know what to do. Grab your cell phone and get ready to text your answer to 22333. Here is our first question. Do you think e-cigarettes should be banned entirely? Dr. Robertson, I'm just going to go out on a limb and say I think I know your answer to this, but I'll let you discuss.
Well, I would say that, no product that hasn't been proven to be safe, should be able to be marketed. It was remarkable that there was a waiver for these products. We have safety provisions for all of the other things that people can buy. Food, automobiles, every kind of thing has to go through a safety test. Mm-hmm. And so, this great delay in having e-cigarettes go through that, really has been, a terrible problem, and has allowed industry to experiment with ways to addict not only our children, but also adults. So, young adults, even older adults may try these products for the first time. And people, again, often don't realize. They say, well, you're exposed to fewer things, to fewer chemicals. And while you're not exposed to combusted chemicals, we still can measure levels of volatile organic compounds, the kind of thing you try to buy a paint that doesn't have. Things like acrolein, which we know is associated with cardiovascular disease, that, we see those in people who use only e-cigarettes, not combusted cigarettes at all, and other volatile organic compounds as well. And we can measure the effects of those, in cells from people, or in various complex biochemical ways. So we're building a body of evidence that continues to concern us more and more about the potential toxicity of e-cigarettes, and it takes a long time to get the clinical evidence. When people were advertising cigarettes for women, "You've come a long way, baby," we remember that campaign. It took 40 years after that for lung cancer in women to catch up with lung cancer in men who were already smoking. Mm-hmm. We don't want it to take 40 years for us to say, gee, this was really a bad idea to have people use these products, which now we see, are able to cause great harm.
Well, it looks like a lot of people agree that e-cigarettes should be taken off the market. Upwards of 40% answering yes, we think they should be. We have about 10% of people saying people should be able to choose, and then a good majority saying only adults should have access to them. So thank you, everyone who took the time to go ahead and answer. Let's move on to our final question of the day. True or false, trying an e-cigarette just one time is not risky? Dr. Robertson, I'm going to go out on a limb here again and say that we're going to say true, it is risky. And the reason I would guess that is because it only takes one time for someone to decide that they want to do it again and again and again, and then the addiction spins out of control from there. So what is your medical opinion on this?
Right. I want to be realistic about this. And, we do think that kids should not try an e-cigarette even once. Uh, you know, do people become addicted the first time they use a product? Uh, that would be a rare event. Are they harmed the first time they use a product? Products explode every now and then. I mean, there are some graphic pictures of jaws torn apart. Those are also rare. So, I think but your point is really the right one. I'm sort of trying to stick to the hard science here, but if you try it once and you like it, you may not think of it as something that you're becoming addicted to, but it doesn't take trying it very often to have you like it enough to keep doing it. And with addictive chemicals, what that means is that you want it more, and a little bit is not enough. And so we find that we measure it, for example, by how long after you wake up do you vape. That's a measure of your dependence. And sometimes it's the very first thing people do. So, and kids are finding now that they don't like the sense of being addicted, of being controlled by a chemical, a device, something that they have to have. So, but by then it's really tough to stop. So people who say, well, I just use it on the weekends, or I just use it every now and again, they also run a risk. And we've studied the transitions, and we find that people who try e-cigarettes often try more, often get addicted, and then a number of them will transition to smoking combustible cigarettes. So, they didn't save themselves that exposure either. So I'd rather have people not ever try it, for sure. I certainly don't want youth to ever try it. And I think people don't recognize that there is a risk, to even doing it once. But of course, the risk is greater if you do it over again.
64%, by the way, saying false. They think trying an e-cigarette just one time is not risky. All right, Dr. Robertson, thank you so much for joining us and really reintroducing us to the ugly truth about vaping. A lot of us probably, like you mentioned, forgot about it because we're in a pandemic. It's still an important issue to talk about, especially since COVID-19 has shown to cause shortness of breath and breathing difficulty. The healthier we can keep our lungs, well, the reality is the better we can protect ourselves. I'd like to give you the floor, Doctor, for any final thoughts.
Well, I'm glad you brought up COVID, because there's been a controversial discussion about whether smoking or vaping could be protective, because the levels of smoking in early reports and in several that have come along, have suggested that smokers are not represented at their at the population level in people who are hospitalized. We think there are a number of reasons, and other investigators in this field say, that data may or may not turn out to be true. There are a lot of reasons why people might not admit to smoking or vaping when they're being hospitalized. They might feel that physicians wouldn't take as good care of them. I mean, there are all kinds of psychological reasons, and they might just be too sick to really be thinking about that, or to have people take time to ask the question. That's why we actually started a COVID-19 infection registry for hospitals. More than 150 hospitals have signed up. We have more than 10,000 patient records now. And one of the areas of investigation is whether people are people who smoked or vaped prior to getting COVID, and what it does in terms of the outcome. We think that there seems to be little question that smokers don't do as well in the hospital. But is that because of the disease that smoking already caused before they got there? and what's the effect of nicotine. And nicotine replacement therapy is actually being tested in some clinical trials to see if it has a beneficial or a deleterious effect, because the data isn't there. Trying NRT, nicotine replacement therapy, is not the same as saying vaping might be something that should be tested, because there are all those other things in e-cigarettes that are potentially harmful, and a number of which we have already demonstrated to be bad for you.
Dr. Robertson, based on the comments that I'm seeing on all of our live videos, I would have to say your insight has been helpful to so many people out there. So we thank you once again for joining us today, and I hope you have a great week.
Thank you, you too.
All right, before we sign off, we have one more thing to share with you, and that is my favorite segment, our weekly health hack. Health Hacks is brought to you by the Stories of the Relentless, the American Heart Association's podcast. You can go to heart.org, iTunes, Spotify, or Google Play to find it. You'll find more amazing stories and conversations on a variety of topics. So I encourage you, go check it out, subscribe, share your thoughts in the reviews, and share it with your friends and family. All right, this week's health hack coming to us from Alex. Hello, Alex. Alex has found ways to sneak in some exercise while he's working from home. He takes meetings while standing or walking around the house. He also keeps a small squeeze ball at his desk to help relieve stress. Really great tips. I think that it's really helpful to see that he's trying to incorporate better ways of healthy living and healthy working, especially when working from home. So thank you for those tips, Alex. We really appreciate you joining in with us today. Now, we all know it is so important to stay as active and healthy as we can. So remember, we're going to feature a new tip every single week. So if you have a great idea that you're already doing, why not send it to us? Send it to heart.org/housecalls. And guess what? Maybe you will see your idea live on the show, because guess what? We can all use all of these good tips for a healthier life. Before we go today, I do want to give a quick shout out to Shujin from Haiti. We have Michelle from Montreal and Cheryl from California, all watching us on LinkedIn, and we so appreciate that. And then we had Kim from Ohio and Josie from Illinois on our Facebook broadcast. We so loved having all of you join us on this Monday, and we're looking forward to you joining us every single Monday as we continue to cover a wide array of topics. Now, as I mentioned earlier in the show, you can find any of our previous episodes at heart.org/housecalls. And for any of the questions that you commented today or sent in to us that we did not get to, well, the House Calls After Show, that will be available for viewing online on Wednesday. Thank you so much, everyone, for your time on this Monday. I hope you're going to join us again next Monday. Once again, my name is Chelsea Helms. I'm coming to you live from the KNWA News Studio in Northwest Arkansas. I thank you so much for watching and hope you all have a wonderful week.
Learn more about House Calls, Real Docs, Real Talk, and submit your questions at heart.org/housecalls.